Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Rotavirus infections. Introduction. Rotavirus is a virus that causes severe diarrhea. It can also cause vomiting, fever, and dehydration. Rotavirus infections are the leading cause of diarrhea in infants and young children. It is very easy for children with the virus to spread it to other children and sometimes to adults. This program discusses the diagnosis and treatment of rotavirus infections. Information about what causes these infections and what you can do to treat rotavirus is also included. Rotavirus. Rotavirus is a virus that causes inflammation of the stomach and intestines, also known as gastroenteritis. The rotavirus disease causes severe watery diarrhea, often with vomiting, fever, and abdominal pain. In babies and young children, it can lead to a dangerous loss of body fluids, also known as dehydration. Rotavirus is the leading cause of severe diarrhea in infants and young children worldwide. It can be life-threatening. Rotavirus can spread easily. Good hygiene and cleanliness may help lower the risk of a rotavirus infection, but they are not enough to control the spread of the disease. Rotavirus vaccines are very effective in preventing an infection with the virus. The routine vaccination of infants with either of the two available vaccines is recommended. Symptoms. Rotavirus disease is most common in infants and young children, but adults and older children can also become infected with rotavirus. Once a person has been exposed to the virus, it takes about 2 days for symptoms to appear. Adults with a healthy immune system do not usually experience symptoms from the rotavirus. Symptoms can include abdominal pain, black or bloody stool, poop, or stool with pus, diarrhea, fever, loss of appetite, vomiting. Vomiting and watery diarrhea may last from 3 to 8 days in a child who is infected with the rotavirus. Severe vomiting and diarrhea can lead to dehydration. Dehydration caused by a rotavirus infection is more common in infants and young children, people with other illnesses, older adults. Symptoms of dehydration in children and adults include decrease in urination, dry mouth and throat, feeling dizzy when standing up. A dehydrated child may also cry with few or no tears and be unusually sleepy or fussy. Dehydration can be especially harmful in infants and young children. Make sure to contact your child's healthcare provider right away if you suspect your child is dehydrated. There are many different types of rotavirus. Neither vaccine nor natural infection provides full protection from all types of rotavirus. This means that vaccinated and unvaccinated children may develop rotavirus disease more than once. Usually, a person's first infection with rotavirus causes the most severe symptoms. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Rotavirus spreads easily through hand-to-mouth contact. People can spread the virus both before and after they become sick with diarrhea. The virus spreads by the fecal-oral route. This means that the virus is passed from a person's body into the environment in the feces or poop of an infected person. The virus must then enter another person's mouth to cause infection. Rotavirus can be spread by contaminated hands, food, objects such as toys, surfaces like countertops, water. Diagnosis. A healthcare provider can often diagnose rotavirus based on symptoms and a physical exam. In some cases, a stool sample may be taken. The sample will be analyzed in a lab to confirm the diagnosis. Treatment. There is no medication to treat rotavirus infections. Antibiotic drugs will not help because antibiotics fight bacteria, not viruses. Dehydration is a major complication of rotavirus infections. It can lead to other serious problems. Severe dehydration may require hospitalization for treatment with intravenous or IV fluids. These fluids are given to the patient directly through his or her veins. The best way to protect against dehydration is to drink plenty of liquids. This is known as oral rehydration therapy. The most helpful fluids for this purpose are oral rehydration fluids, also known as ORFs. Several products with ingredients similar to those in ORFs can be used to prevent or treat mild dehydration. These products, called oral rehydration solutions, are sold as pre-mixed fluids. Talk to your healthcare provider to learn more about ORFs. Oral rehydration solutions are commonly available in stores. If you are unsure about which product to use or how to use these pre-mixed fluids, contact your healthcare provider.
Babies can drink breast milk, formula, or a small amount of ORF to treat dehydration. Avoid giving a child food with added sugar. They should also avoid soda, juice, and dairy products other than yogurt. These can make diarrhea worse.
Severe dehydration can be serious. If you think you or someone you are caring for is severely dehydrated, contact your healthcare provider. Prevention. Rotavirus vaccines. The best way to prevent rotavirus is to get vaccinated. The rotavirus vaccine may be given at the same time as other childhood vaccines. Babies who get the vaccine may be fed normally afterward. Healthy adults do not usually need a vaccine. As with all vaccines, there can be minor reactions, including pain and redness at the injection site, headache, fatigue, or a vague feeling of discomfort. Talk to your baby's healthcare provider to learn more about the side effects of the rotavirus vaccine.
Intussusception is a condition where the intestine folds into itself. It is a very rare and life-threatening side effect of the rotavirus vaccine. Children who have had intussusception before are more likely to get it again. These children should not get the vaccine. Hand washing is another way to prevent the spread of the virus. Wash your hands for 20 seconds after going to the bathroom, helping a child use the bathroom, or changing a diaper. Make sure your child washes their hands as well. If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Rotavirus is a virus that causes severe diarrhea. It can also cause vomiting, fever, and dehydration. Rotavirus is the leading cause of diarrhea in infants and young children.
Infections happen most often in the winter and spring. It is very easy for children with the virus to spread it to other children and sometimes to adults.
Rotavirus cannot be cured with medication, but symptoms such as dehydration can be treated by replacing lost body fluids. Special rehydrating drinks are available to treat dehydration.
There are many different types of rotavirus. Neither vaccine nor natural infection provides full protection from all types of rotavirus. This means that vaccinated and unvaccinated children may develop rotavirus disease more than once. Hand washing is another way to prevent the spread of the virus. Wash your hands for 20 seconds after going to the bathroom, helping a child use the bathroom, or changing a diaper. Make sure your child washes their hands as well. Thank you for using Explain.